So I think remaining questions and controversies from the data that I've just shared with you are operative approaches. So this is the pre-op and the post-op treatment. Is this superior to pre-op only, so neoadjuvant only, or post-op only, adjuvant only? Which patients require additional therapy after neoadjuvant chemo IO? I think that's one of the big questions remains in the field. How much therapy is needed? I shared with you the different trials. You'll notice that the studies are somewhat heterogeneous in terms of the number of cycles administered, some of the stage subsets that were included, the treatment regimens, the biomarker subsets. And so I think, sometimes when we see these heterogeneous trials, it's hard to really make out, which of these is really the best strategy. Are there ways that we can think about these different drugs and different study designs to really try to apply these to the patients that we're seeing in our clinics? What is the role of pathologic response in determining long-term outcomes? So this is, of course, looking at pathologic complete responses versus major pathologic responses. So should we be looking at that in order to determine who requires additional therapy? And then finally, is there a role for circulating tumor DNA for individualizing treatment decisions? I think there's a lot of hope in this, but I think we're just not ready right now for prime time and for using these assays in the clinical setting.